Welcome. I am extremely excited today to have Nicholas Bradley on our to have a discussion today. And this is if you're new to this YouTube channel, subscribe below, sign up for our newsletter, and grab a copy of my book. It's Healthy Kids, Happy Moms. And today we are going to have a great discussion about Nicholas and his journey into healthcare, into integrative and functional medicine, and we're going to talk about eczema. So, I just a few words about Nick. I met him at a conference last year, and you were so dynamic and engaging and interested. I loved meeting you. And then I've gotten to learn a little bit more about him, and you spent a lot of time in Alaska. You are have been in the military. And just before we started, we were talking a little bit about this, and which I want you to share a little bit about that in your journey. And he's a physician assistant, and you are currently working at Shine Pediatrics, which sounds like an absolutely amazing practice in Texas. And he's got an incredible 4-page CV, which I wish I had time to go through everything, but you've had a really wide variety of experiences, including being out in the field in right in the military and addressing wounds and really caring for a huge variety of issues. And I would love to hear some of that experience and how that led you into what you're doing today. I mean, integrative pediatrics from right some combat in the military to integrative pediatrics.
Yeah, it's been actually a really amazing journey. So it began, 15 years ago, essentially. I decided to become a PA, and they had a program in the Army called the Inter-Service Physician Assistant Program. And I applied for that program, and it was basically learning through a fire hose. As anybody in the field of medicine understands how medicine works, it's literally go in and just take as much as you can, regurgitate as much as you can, and get through.
Mhm.
So, in the service, as a PA, we're pretty much heavily trained into emergency medicine, orthopedics. That's primarily what we see, and that was kind of my field. So coming out, and of course, primary care. So primary care is definitely dabbed throughout that. But dealing with mainly a healthy population, 18, 50-year-olds. Most of what I dealt with were just injuries, orthopedic injuries. We'd get the typical routine sick call stuff, and then obviously when deployed. It was more trauma-based medicine, depending on what your job was and where you're at. So I did that throughout the service, and then as I progressed through the service, you gain rank, and with rank comes responsibility and new jobs, and further away from medicine. And then I kind of came to a kind of that crux of my career, that path, that split in the fork, where I decided, well, either if I want to continue practicing medicine, it's probably best I get out. I could stay in and continue this. It was great, but it was time to continue practice. Otherwise, I'd lose it. It would just go away. And
Mhm.
and that happened to coincide right at the time of my retirement. I submitted in 2019. Now, it takes a year for you to actually get off active duty. You submit your retirement, and it's a year process before you're out. Well, I submitted my retirement the summer of 2019. And we all know what happened 2020. So it was fortuitous at the time because there was obviously a lot going on in the service after COVID. But I transitioned out. I happened to be in Alaska at the time, and that's where we settled. And the most logical fit for me at the time was urgent care, coming from the military, having that experience in trauma-based medicine, and then orthopedics, and then your typical routine clinical medicine. I thought urgent care would be a nice fit for now until I figured out what I want to be when I grow up out of the military. But in that time, I read a book, and it was written by Dr. Weston Price. And this was right around 2020. And it was called Nutrition and Physical Degeneration. And
Mhm.
that book had me thinking differently about some things. And I started questioning some things about health overall, but not much applicable to urgent care medicine. People come in, and what we say is treat and street, right? Get in, we treat, and you're back out. So, but that's kind of the seed that was planted during that time in 2020, as I was working urgent care during COVID. I started learning new things about medicine, obviously through the wild times that everybody experienced, and everybody has a unique experience through that endeavor. But I came across some names like Dr. Paul Thomas, Dr. Larry Palevsky, and I started listening to these guys, and I started reading some of the literature they were providing out there and their experiences. And I was really touched because prior to this time, I didn't do any pediatric medicine, but uh, Larry really touched a nerve, as did Paul. And I think that also planted that second seed that maybe down the road this would happen. Well, we fast forward to about 2022, and at this time, I was more fascinated with actually trying to fix people from a root cause perspective, opposed to literally the band-aid approach. And urgent care is very much a band-aid,
Mhm.
but also in clinical medicine. And I wanted to get a better understanding about that root cause because it just people were coming to me in the clinic with things that didn't make sense, and they weren't getting anywhere with anything. And they
Mhm.
would come in, we would have even eczema flares would come into urgent care. And I'd look at it, and my tool bag was literally one thing: steroid. Here's your
Mhm.
steroid. And then you get three choices. Do I go low potency? Do I go mid potency? Do I go high potency? And then it was go see a dermatologist afterwards. But that's so unsatisfying. I'm not doing anything for them. I'm giving them something, and I may be actually harming them. And as I learn in clinical medicine now as a pediatric, the last thing I want my patients seeing is urgent care because they're just going to do
Right?
something that's going to mess up something.
Right? And nothing against urgent care
No,
provider,
not at all.
the way the system is set up. And that's exactly, I've said that 100 times to my patients. Let's, you know, let's figure this out so that you don't end up in urgent care. And right, it's always, and what we're doing in integrative and functional medicine is so that you can just go to your annual well child check. Um, so you, when you and I was doing a talk at a conference, a wonderful conference. It's called MAPS. It's a medical um, education conference, and it's for special needs kids. Which so you have now come from, right, all doing the Army or what the service,
Mhm.
and then now you're in urgent care. And I meet you fast forward after you've been in pediatrics for a little while, and the excitement you had when I met you, you were my favorite person talking at who I talked to at the conference. And you have clearly started to put together all these pieces in the puzzle, right? Because when we're in solely using the conventional medicine toolbox, it's steroids, antibiotics, antacids, and you quelch the symptoms for a couple of weeks and then they flare back up again. And so when how long did it take you to kind of figure out and physically make that transition? Because that's the other thing that I have found is that you start to learn this stuff and then you have to have a different system to work in so that you
Mhm.
can actually do some of these things.
Yeah, I think you should sort of preface that just a little bit of how we met. Um, you know, when once I came to pediatrics in 2023. That's when I kind of got the calling. This is time to move, and I moved my family from Alaska to Texas to this clinic because this clinic had a mission that met what I was looking for, and that's working with kids at the deepest level, solving the biggest problems for them, and that just really connected with me. And there was definitely a spiritual component to the person that runs this clinic, and that meant a lot to me. So that's what brought me there. But seeing one thing I noticed early on in clinic was eczema, eczema, eczema with these kids. And Sheila, I can't tell you how many times I would tell my colleagues if I could figure out one thing of all the childhood disorders that I see in clinic, it's eczema. Give me something there, and
Mm.
that would be profound for me because it didn't make sense. We would get healthy babies with eczema. We'd get sick babies with eczema. You'd get everything in between with eczema, and it didn't make any sense. So I would, the typical stuff I would use, my tool bag, obviously at this point, I wasn't into steroids. So that was not even, we didn't even discuss steroids. So I'm long beyond that at this stage. Where I was at was looking at diet, collagen, anything to help with connective tissue. How are we going to fix the gut and getting inside the microbiome? And then topically, my tool chest was literally we can do some tallow, we can mix it with some lavender, we can try some frankincense, we can try to tamp down on the Th2 response with some type of anti-inflammatory from a natural perspective, whether it's quercetin or PEA Soothe. That was my toolkit. And for some we got some modest improvements, but I really wasn't getting to the surface. So I had a patient come in and they mentioned your name. And this mom was one of those, and I tell you, I love moms because there is nobody in this planet willing to
You-
do the research like a mama. I mean,
Yeah.
no. And they would come in and they would teach me, like, have you heard of this? I'd say no, and I'd have to go research that. Or they'd come in and say, have you ever heard of Dr. Sheila Kilbane? She's got a protocol and she uses this Dr. Aaron or whatever, this cream. And you heard of this? And no, I've never heard of Dr. Sheila Kilbane. So I'd go online and I'd search you up and I'd start reading a little bit about what you're doing. I'm nodding my head. Yeah, that's something there I'm doing. This is something there. But then to have that fortuitous event of going to this kind of died off for a while, but going to that conference and then running into you, there was the energy because that was a synchronicity for me that said, hey, here's your opportunity. Somebody planted this and let's talk about what we can do for kids. So that's kind of the background into meeting you and then getting into kind of the protocol and your discussion and balancing that Th1, Th2 response, then going into the 5 areas specifically. And I'm only really going after 2 or 3 of those, and not, didn't have quite that tool chest that you now have provided me. So that's kind of that background.
Well, and it's interesting too, because I was a last minute, I wasn't going to go to that conference. I just had so much going on. And then at the last minute, I said, I am able to come. And they said, oh, that speaking spot has been filled. And so I said, well, let me know if somebody cancels. And, they called and said somebody did cancel. So please, go ahead and come. And so what Nick is referring to with treating eczema is it's this whole systems approach, and it's truly using the best of conventional and integrative, right? Because it is this compound that we use from Dr. Aaron, who is this brilliant, wonderful dermatologist out of South Africa, he's been practicing for 40, 50 years, and it's compounded. He used his actual dermatology training, which was mixing things together. And so it's the synergy of this. And what we're really doing is we're treating people with eczema have a higher bacterial count on their skin, specifically staph. And so when you get that really red, almost like a burn patient looking skin, that's a staph infection. And we have to treat it like we treat pneumonia or like we treat an ear infection. And when we quelch that staph bacteria, that staph secretes a toxin that continues to contribute to flares. So you and I have both seen many patients who have taken so many foods out of their diet because in the functional and integrative medicine world, we preach gut is the window, right? Gut creates what's going on in the skin. And we have some newer research that shows when the skin barrier isn't intact, that actually contributes to the inflammation in the intestine, or leaky gut is what it's kind of affectionately been come to known as. And Nick, you've told me a couple of really powerful things, and that as you started working with patients, you have people flying in now to come and see you because of how well, and it's about using this combo approach, right? Of addressing the gut, treating the infection, and then you're bolstering the cellular health. So tell us a little bit, whatever you can, about the a couple of the cases that you shared with me. We
Sure. Sure.
You have to use
Yeah,
it.
and yeah, we have so we have I had a case come in from Midland, which is 4+ hour drive from us. And this poor kiddo, it really, when I first saw this patient, he looked like a burn victim. I mean, it was some of the worst eczema I have ever seen. And if I'd have seen this patient 2 years ago, I had no clue, no clue. I mean, we'd start diet and I did do some basic stuff, but I wouldn't have any idea. But came in and went through the typical, but instead of a steroid approach, they tried for a little bit. They went right to biologics, and that's pretty heavy hitter for such a young child, and they weren't getting any results, none at all. So right off,
It's
right out of
also
the
heartbreaking because it's up all night itching. I mean, I've
yes,
had so many patients, they don't want to wear, even the younger kids, they don't want to wear shorts, they don't want to wear t-shirts, they don't want anybody to see their skin because they feel embarrassed, and it's just uncomfortable to have that
yes.
sensation of itch.
Well, and in this case, this was a C-section child, and shortly breastfed. Mom was an underproducer, had some problems, and then had to switch over to formula. And
Mm.
so, you know, you're missing some components there, right? We missed that vaginal delivery, and this started right. I think within the first month or two, the eczema started, and mom hadn't seen the normal skin in her child in over a year. So I see the child after that, and it's been literally what I'm looking at for the past year and trying to keep it down. And as you're talking about with the chronic itching, you have all these excoriations, these breaks in skin, particularly in the flexure creases, the back of the neck, on top of the scalp. And it just was, and you scratch, and then that infection just runs, and it runs once you break that barrier. And it's this circular. It's this positive feedback loop. I scratch, I open, more comes in. I scratch, I open, more comes in. So you're just getting this perpetual worsening of this skin. And obviously, first order of business is we go right to the gut, and we start a pretty significant probiotic digestive enzyme regimen. We talk about the nutrition piece. We have to look at the allergies. So we're running allergy panel to see what out there can be offending this. And of course, it comes back with everything, just everything. So now we're extremely limited in what we can put in. We're the typical players of your gluten. Most of your wheat products was really, really high. Most of your dairy products was really, really high. All the nuts, all the seeds. So we're really limited in what we can do, but we have to stop this inflammation and we have to stop the itching. So with the protocol, and I didn't want to call it a protocol because what it is, with addressing every facet, it would be more
Method,
appropriate.
maybe.
When we start addressing everything, the itching, the infection, the inflammation, the gut, the cellular repair, everything, when we start looking at everything and I start applying all of these principles of addressing those areas, we had vast improvement. And I'm not talking improvement within months, and it was within
Like,
the month, within days,
It's
mom.
it's days to weeks.
Yes, yes. So, and as soon as when we get these cases, and if I have eczema, significant eczema, I want to track and follow the patient every month. And then, this family, they're going to do everything they possibly can to get this under control.
Mhm.
And so within that first month, when I had or that month follow-up, mom comes in and she's in tears. And it was just amazing. She said, "This is the first time I've seen my child's skin since birth." And that
Oh,
that right there. And it was utterly amazing. But understanding that this is going to be a process.
yeah.
We have achieved something magnificent at this stage, and we have a long way to go. And I think we understand that, and parents understand that. Because eczema can be a lifelong disorder. I mean, it's just not something that's going to be done overnight. Now, as our microbiome shifts and we get older, the hope is there that we see far lessening as it matures and we're able to start bringing back in the things that we weren't able to do. But this, Sheila, was amazing win. And that's not a single case. And I'm seeing more typical with my moderate to severe eczema kiddos. following this structure of looking at all these different areas and addressing every single one individually.
I love that so much. And I wanted to go back just a minute to the allergies, because one of the things when I first started talking with Dr. Aaron about, because we would get on Zooms and, I would ask him about cases and things, and he didn't do a lot with food, because as you get that skin barrier more intact, the food sensitivities, sometimes the food allergies, like I would never promise that this cures food allergies. It helps it helps rebalance the system so that we give that child the best opportunity to outgrow the allergy, or set them up for success in that way, so that we can start to incorporate more foods into their systems. And we don't do a lot of food testing up front anymore, because we have found that everything comes up. We know what the big players are, right? We know that dairy, gluten, eggs can be really big triggers. And a lot of times the families will have a fairly decent idea of what foods definitely trigger them. But that's what, for anybody listening, I just want those things in the process start to improve. And it's just like you said, it's multifactorial. And when Dr. Aaron uses his cream, a lot of the patients will stay on it for a long, long time. And in my experience, we're able to start to wean the topical within a few months, usually. And then
Yes.
we'll do spot treatment on them. And has that thus far been your experience as well?
It has. It really has. Yeah. And I start out pretty aggressive just to tamp that down. And going back to what you're talking about with the food allergies and the response, it's as if, and one thing we also do is we look at some gene lines, particularly inflammatory genes, and invariably what I see with my eczema kids is they have a very aggressive gas pedal when it comes to these protein signalers for inflammation. So when you see that, it doesn't, if we're aggressively responding that fast to these, to pathogen, allergen, anything along those lines, then food is invariably going to fall into that, because our body will start recognizing it and just going after it after we just build this very over response to something that we shouldn't be aggressively responding to.
I love that descriptor, the gas pedal on the inflammation.
Oh yeah. Yeah.
It's right. That's how it's asthma, eczema, allergies it's a hyper reactive immune system. And so their body sees an allergen and the body just goes boom, and it sends a lot of excess cells to different areas of the body.
Mhm.
The beauty also, though, of this approach is that it works with asthma, with eczema, with allergies, and it's a very similar, because it's setting the foundation and we're looking at the root of
Yes.
right, our T helper 1, our T helper 2, and it even in inflammatory bowel disease, autoimmune conditions, it really it's such a big toolbox. But particularly with the Dr. Aaron and the approach that we use, it's like you put out the fire.
Mhm.
And then that's how we get the quick response. I wanted to read a little minute. This is page 41 of my book, but because I think of these kids as kind of the canary in the coal mine, is that this eczema is, like you said, sometimes these kids are healthy, sometimes they have recurrent illnesses before they get this, but we're seeing it, the rates in the 1940s, the rates of eczema were about 5%, and it's now up to 20% in certain populations. And that's a very short period of time for something to increase so quickly. And some of the things, right, we know that processed foods, this is page 41 in my book, hand sanitizers, right? We know that hand sanitizers have created almost superbugs, bacteria that is more resistant to antiseptics, and then herbicides, right? So things like Roundup, and glyphosate is the active component in Roundup, it was originally patented as an antibiotic, and since dramatically increased since 1996, there's a 15-fold increase in the use of herbicides. Um, Antibiotics, right? 270 million antibiotic prescriptions written in 2015, which is equivalent to 838 antibiotic prescriptions for every 1,000 people. But the actual biggest culprit for antibiotic use is in the animal industry, right? And
Right.
I mean, Texas has tons of big cattle farms, right? And we put antibiotics in the feed. So we're being exposed to all of these things. And what 3.5 kilograms of 3.5 million grams of tetracycline was used in 2017, predominantly in the cattle and the swine industry. And then the last thing is our C-section rate. It's up to 30% in some areas, which is a 60% increase from 1996 to 2011. And you'd mentioned C-section. Do you want to share what the difference between C-section versus vaginal delivery and why that matters?
Yeah. So yeah, typically, C-sections are performed obviously in a hospital. So when you have that transition, that is the first experience that that child has with the bacterial world, and that is mom's canal. So there's an implantation that occurs as baby transverses down that canal. And that is, if you think about it, it is truly a beautiful thing because if you were born from mom and you're a female, you're passing on these species, these lines of bacteria from generation to generation to generation to generation to generation. It's actually it's fascinating that inside of you lives generations of these species of bacteria coming down that. Well, obviously there are certain cases where C-section is certainly required, right? We
Yeah,
need to have a
yeah,
C-section, albeit I am on the other side where I think we're way overdoing it. I think we're jumping the gun on these procedures, but there are cases that absolutely do require that. But once we have a C-section, that child's first experience with the bacterial world is the hospital. And we think about what's inside the hospital. We're talking about Clostridia, Klebsiella. We're talking about strains of bacteria that aren't indigenous to our microbiome, that aren't indigenous to human. Now they're indigenous to the world we live in, but not to human life. So that becomes the first. And I've actually read many studies where they've taken microbiome samples from from patients that are 40 years later, they would look at their microbiome, the population comparative between C-section and vaginal delivery, and you still see those hospital strain growth. They maintain kind of a foothold in that microbiome for life. It's there. It's always going to be there. So when you're coming into the hospital, we're getting just a population of species that aren't normal to us. And that's the big difference. So if you think about how the human body would respond to that, well, I think what we're seeing with eczema, asthma, allergies, routine infections, I think they all have a role to play. I think that is definitely a genus of that. So
yeah. And I recently read an article that talked about it. We do get that maturation of the gut, and we can't. So if you have had a C-section baby, there's so much that we can do to help balance that out. And one of the articles I recently read talked about that by age 5, we can have a better balance. And the gut is maturing all through our young age, and it continues, or our young life, it continues to mature. Um, and the way that I look, so I don't do primary care anymore, but when I was seeing those babies when they were a C-section, I was putting moms on, if the mom was solely breastfeeding, we would put the mom on a probiotic. If the baby was bottle feeding, we would put the baby on a probiotic. And it's the earlier you look at this, the better chances we have. And looking at everything, right? I always talk about clean air, clean water, clean food. We want to make sure that whatever we're getting exposed to for these kids, we're really cognizant of what's happening to their entire environment. And I have to go back to you're making me think of a sourdough starter with the bacteria. I
Yeah.
love the way you describe that.
Well, and I want to add one thing to that when you talk about the clean water, and I think a very important facet of that, and many of us don't think about, is our showers and our water supply. If you're off city water, one thing you could do is just change the head of the shower for the baby to make sure we're filtering out a lot of that chlorine and all the other chemicals that are placed in the water. Not just what we're drinking, but what we're bathing in, because typically, I mean, when we're bathing in, we're putting antibiotics on our body. We're putting stuff that eliminates that protective barrier.
And part of what Nick is talking about, right, is that when we test our local water supplies, we're not testing for a lot of the things that are actually in it. They're testing for microorganisms, bacteria, parasites. But what's happened is because we're putting all of our antibiotics, people flush them down the toilet, or all of our, whether it's everything from Cialis, right, which is a male enhancement hormone, to albuterol, to SSRIs, these are in the water supply. We're just not testing them on the city-wide level or the county-wide level. So it is really important to filter your water. I mean, that's one of the first things that we talk about in our practice, right? Is clean water and clean air, because we can be doing everything right, but if we're getting exposed to these things all the time, especially in a compromised system, right? You and I see the kids, they're coming to us from a depleted state. So we just need to make sure that we're getting them back up to where they need to be. I think the good news about this, because we can start wrapping this up now, but the good news is that there are so many things that we can do. And I think we can get into the doom and gloom, and it can feel overwhelming for parents. But if you just take it one step at a time and reach out, you are at Shine Pediatrics, right? How can people find you?
If you go online and look up shinepediatrics.com, we have we have one new clinic, three clinics in the Dallas-Fort Worth area. I work on the Fort Worth side. We have one over in a town called Richardson, and then we're opening one up in McKinney. So shinepediatrics.com if you're in the DFW area or in Texas, by all means, come see us at Shine. It's a great facility.
That's amazing. Thank you. And so just back to that, just taking things, if you're a parent or if you are someone who has eczema, right? We all have a lot of resources online. Reach out to one of the clinics, and changing one thing at a time, right? And starting anti-inflammatory diet, looking at your gut health, finding one of the providers who really understands how to address the skin and the gut health. And there's so many things we can do. We have such a much bigger toolbox now that we're able to work through some of these more complicated issues with these kiddos. So Nick, anything else you want to?
Yeah, I do want to say one last thing that, and what we talk about when we look at the world we live in, right? It can create angst and fear, right? And stress. And that is such a major player in all of this.
Yeah.
Because stress of a mom, stress of a dad is stress to a child, regardless if it's a baby or somebody older, toddler, or a child. I mean, the stress is stress, and that can be conveyed. So information is beautiful. It gives us knowledge. It gives us peace, because the more information we have, the better understanding we have. It should reduce that stress, not create that stress. So we look at all these things and we think, oh my goodness, they got antibiotics in the food, they got antibiotics in our water supply, they got bad air. There's nothing we can do. There's everything we can do. If you think about the microbiome. We just really learned about, we're
Right.
learning about our microbiome. This is a event horizon that occurred in the early
Right.
2000s. So we are scratching the surface of our understanding of the microorganisms and their relationship with us as human beings. Imagine where we're going with this
Yeah.
knowledge. It's going to get more and more profound. So like you're doing and Dr. Aaron is doing is you're giving that hope. And I love this. It's kind of a paraphrasing quote, but it's by Voltaire. And he talked about that the role of the physician is to entertain the patient so that nature may cure the disease. There is so much truth to our body's innate ability to heal. And if we can just continually provide it the best environment to do so, it will. So no matter if you come from C-section, if you came from, you know, bottle feeding and then into routine antibiotic use, the body has the ability and it will continue to find a way to heal. The thing we want to do more than anything else is reduce the assault to the human body. And that is what's so beautiful about what you're doing, what Dr. Aaron's doing, is carving out a way to find a way that we reduce the assaults on the body to allow it to do what God allows it to do, and that is heal.
Yeah, absolutely. I love that. Early on in my career, when I was just out of residency, one of who he became my mentor, but that's what he said. He said, Sheila, we just have to, kids are going to grow and thrive. We just have to, we need to step back and let them, just take away what's harming them, and they're gonna do great. And that is the beauty of kids, is that they're so resilient.
Yes, ma'am.
So, Nick, we could talk for 2 hours. Thank you. I appreciate your carving time out of your day, and thank you all for listening. And again, Nicholas Bradley, who is a physician assistant with a tremendous amount of experience, and thank you for the service you did for the country. And he is now at Shine Pediatrics. And if you're new to this, to our YouTube and to listening to us, I'm Sheila Kilbane. I'm an integrative pediatrician here in Charlotte, North Carolina. We have lots of free resources online, and grab a copy of my book, Healthy Kids, Happy Moms, 7 Steps to Heal and Prevent Common Childhood Illnesses. And thank you so much for joining us, and just share this with anyone you think may be helped by this information. Thanks so much.